Currently, over 700 health workers are known to have been infected across the country. At least 2 have died. It's the reason that the multimedia group has launched the Save the Health Worker campaign today. And shortly, I'll be joined by Gary Al-Smith, who is leading this campaign. But just last week, the Ghana Registered Nurses and Midwives Association voiced their concerns about the pressure faced by members at health facilities in the country. Currently, over 700, like I said, once again, workers are known to have been infected by the disease. Gary Al-Smith joins me right now. He is a survivor, as you may well be aware of, and he's here with me on Zoom. Hi, Gary.
Hello, Gifty. Thank you for having me.
Great. Let's start with what we're seeking to achieve with this campaign.
As you heard from the fine gentleman speaking there are real challenges. So first of all, I think that, what this campaign seeks to achieve is to collaborate with all stakeholders to achieve the common purpose of saving the health worker by making their work easier, by also making sure that they are as protected as possible, and also ensuring that in the end, the number of cases is as low as possible. So first and foremost, that is it. But if we should distill it down to the smaller points, Gifty, I think that we can talk about the adequate provision and timely release of PPEs. Adequate provision and timely release of PPEs. We heard the information minister on Beyond the Lockdown on Sunday speaking, quite eloquently that, the government has done its part by releasing the PPEs on time, but they have found out that some people in the value chain, are not doing the needful, and so the things are not getting there on time. What happens when this happens? When this happens, the net effect, Gifty, is that doctors who are working so hard are needlessly exposed to the dangers of COVID-19, and then you have the case where doctors are getting ill. They are not getting tested in time. A lot of them are positive and are infecting others. The chain continues. We have some doctors dying, others going on leave, others being isolated. And in the end, when the ordinary Ghanaian like you and I get ill, go to the hospital, we don't have enough health workers to take care of us because of some of these reasons. So this is essentially what we want to achieve, Gifty.
Right. Let's move on to bring people into the idea, of this campaign. What exactly will be involved in this campaign?
I think that the idea behind this campaign is to be an amplification tool, Gifty. We always hear that the media is the fourth estate of the realm. And so essentially what it is that when issues are, being discussed or solutions are being sought, we simply can give it the volume it deserves. And we seek to, or we believe more accurately, we believe that if you look at the entire COVID-19 chain, from the government who are doing their utmost best, to the civil society, to the health workers themselves, to the ordinary man on the street, it seems that the one group of people who are in the middle, who are caught in the middle no matter what happens, are the health workers. What do I mean by this? Whether the government does its job well or doesn't do it well or doesn't do it adequately enough, the health workers eventually are the ones who are going to take care of all the sick people and the rising cases. When the ordinary man on the street, as we report every day, fails to observe the social distancing and the other protocols, fail to sanitize and they get ill, they go eventually to the health worker. So from down to top, everybody seems to go to the health worker when things get bad. So the least we can do is to equip the health workers, ensure that they have what they need to execute their jobs well, and also to feel as protected as possible.
Let's end our conversation with measuring of the successes or otherwise. And I have no doubts that it will be a success. Hopefully, even if we don't do anything, one life will be saved. One health person's life will be saved. But tell us about measuring of successes as far as this campaign is concerned.
Now, the thing about, as we have learned at the Multimedia Group and Gifty, I mean, you've been, instrumental in several of, for example, the one we did, against Clean Ghana, Arrive Alive, and so on. You do know that when we cover news items on a daily basis, ad hoc, maybe on the 6 o'clock news, on the 12 o'clock news, on the 3 p.m. news, on Pulse, and so on, they seem to be sort of all over the place. But when you centralize them under a campaign, we are able to focus our attentions better. We are able to drive resources better. But even more crucially, because the total sum of what we do is not measured by what we produce but by what people consume, right, and how they consume it, then you are able to draw people's focus to what you, the station, think is an important issue. So by having this banner, Save the Health Worker, what we are saying is that, yes, the entire effort for managing COVID-19 is important, but maybe what may be the game changer is if we centralize efforts to protect the health worker and we do it properly.
Doing it properly is all what this is about. Gary, thank you so much. It's good to have you. And once again, congratulations that you beat COVID-19, you and my producer, Fred Smith, together. So together, we'll be doing this. Gary L. Smith there, he's coordinating our new campaign, Save the Health Worker.